The main principles of treating knee osteoarthritis: if there is pain, non-steroidal anti-inflammatory drugs, NSAIDs are prescribed. These include medications such as diclofenac, diclibur, revmoxicam, Movalis, and others. In addition, local treatments are prescribed in the form of ointments, gels, and various patches containing lidocaine or capsaicin. Chondroprotectors are medications that are prescribed for long-term use, either in tablet form or as intraarticular injections. Hyaluronic acid preparations, which are injected into the joint, various types of physiotherapy procedures, and shockwave therapy are also used. Treatment of the knee joint can be either surgical or conservative. Surgical treatment is usually performed by orthopedic trauma surgeons, and it involves corrective osteotomies in the knee joint area to improve its alignment. Additionally, knee joint replacement surgery is also performed. Currently, the method of endoscopic treatment of the knee joint is being developed, which is based on performing an endoscopic examination of the knee joint, removing small damaged parts of the menisci, as well as so-called joint mice. These are free intra-articular bodies, fragments of cartilage that interfere with and block the joint during movement. In addition, bone tunneling is performed to improve blood supply, and joint cartilage is transplanted to those areas where it has already been destroyed, using cartilage taken from parts of the joint that bear less load. In our center, we carefully treat the knee joint using shockwave therapy. We use Swiss equipment from the company Storz Medical and specifically follow Swiss protocols, which specify a certain number of impulses with each applicator at a specific frequency and power. As a result of this treatment, we successfully treat patients with first, second, and partially third stage knee osteoarthritis. The result of the treatment is that the first stage pain is reduced, microcirculation in the joint improves, and pathological ossifications are broken down and absorbed. Somewhere after the 5th or 6th session, another very interesting process begins. New capillaries start to grow, the process of angiogenesis takes place, and self-regulation of the damaged joint tissues occurs. Our foreign colleagues who have been working with devices, Swiss devices, much longer than we have had the opportunity to assess the long-term results of osteoarthritis treatment. And they have concluded that after completing a course of shockwave therapy, the process of joint tissue recovery continues for approximately another 1 to 4 months. It is definitely not recommended to treat osteoarthritis at home without consulting your doctor, because at different stages of the disease, the approach can be completely different. It is also necessary to make the correct diagnosis And if it is a specific or metabolic type of osteoarthritis, the treatment will naturally be different. Therefore, I will only provide general recommendations for the treatment of osteoarthritis. During flare-ups, when the pain is acute, you should not put stress on the joint. You need to give it rest. Throughout the day, you should alternate periods of activity with periods of unloading the joint. It is important to choose the right footwear. The shoes should be either flat or have a stable heel. Also use orthopedic insoles. Use heel pads. It is essential to monitor your body weight because the knee joints are our shock absorbers. They do not tolerate excessive load. Therapeutic exercises should be done once the acute phase has subsided. These exercises are aimed at increasing the strength of the muscles and ligaments around the joint. At first, you should start doing them while lying down either on your side or on your back without putting weight on your leg. As the acute phase subsides, you can gradually increase the difficulty of the exercises. It is very beneficial to do these exercises in water. In summer, this can be in various natural bodies of water. In winter, pools and aqua aerobics classes are recommended.